Hi, I'm Dr. Sebastian Gonzalez with Performance Place. Today we're going over a little bit of a modification for you lifters out there, or actually people who have experienced certain types of pathology or injuries. I strongly believe that we can work around injuries in regards to strengthening and making it so people don't become deconditioned and basically fall into bad habits as well. So I think, and there's going to be a lot of strength coaches who agree with me on this, we need to train around that injury. We have to keep muscle and keep stabilization around the rest of the body, while the spot that has an injury, that structure has the time to heal. But it doesn't mean the rest of the body can't be trained as well. So a condition we're going to go over today is Chondromalacia Patella, or in generally speaking, runner's knee. It's basically where the cartilage right underneath the kneecap starts to rub away, and this can be for various reasons. I'm not going to go into the pathology too much, but mainly talk about the things that people can and can't do typically. A lot of times knee bend is an issue for these people. A lot of times running hurts as well. Sometimes there's not a lot of rhyme and reason to when this thing hurts. We've had patients that have pain going upstairs, downstairs, bending down to get on the ground to do something like a plank, which is other part of their rehab. So the exercises we're going to go through today are only 3, and there are a lot of ways to modify around this. Again, this is very dependent upon your pathology. I got a list right here that we're going to go through. So higher box squats. Box squats are great because they help out with posterior chain development and proper squatting technique, I believe. We start a lot of people out on box squats, and their weight significantly drops from the front squats or back squats they're doing, mainly because they're having to keep their weight back a little bit more. Now, people with Chondromalacia Patella have issues with depth on these things, so each case is very different, and I strongly suggest you see your healthcare provider or a strength coach prior to doing any of this stuff that we're talking about today. But for the most part, some of the cases we see, we can squat them to certain depth and also change muscular time and tension to make it so they're strengthening the area without damaging the tissue or cartilage. The second one is front plank. Front plank is basically the standard in regards to core stabilization, static core stabilization in a forward-backward plane, sagittal plane, but only moving forward. So a lot of times we do this for hold time, or actually you can also do a side plank as well. We won't go over the technique on this too much, but for the most part, side planking is actually really important in regards to hip drop with runners. So side planking and planking are usually slow twitch fibers. Typically, we hold for longer durations of time. Sometimes when you train them, you want to do it also under exhaustion, so that's another aspect you can add in there later. The last thing we added was hip thrusters. Hip thrusters is great for developing the posterior chain, the glutes, the hamstrings, and so on. It is a modification of a deadlift that I typically use in office here, mainly for injured people. Ideally, we want to get people through complex lifts of squat, deadlifting, push, and pull, but not all the time is it possible with each person's individual condition. But these are things that we're going to go over. Some rough technique. Again, this is not a technique-based video, but it is more so just an empowering type of video, getting you to realize that there's certain things you can modify, keep strong while the tissue is repairing. All right, so this is a modification for some knee pathologies. Chondromalacia Patella is one of them. So we still like people to squat if they can, but it's going to be through modified depth, and you see we have a bench back there. So go ahead and drop all the way back there. It's obviously a little bit far. But certain people might only get to certain degrees of flexion, so go ahead and squat down. So we're going to see that we're only going to take her through here. Bring your feet out a little bit. Usually if you bring the feet out so the knees are not passing the toes, there's not as much knee shearing on this. So again, look at mainly the knee angle. We want to get her through as much range of motion as we possibly can without taking her through any pain. Another modification, you see that the pad is there. Go ahead and grab that pad. We have had patients where they can't even get down to the box, and she's not even that tall, but sometimes it only takes a little bit, and when that person starts hurting, they don't want to do it anymore. So sometimes doing something like this, it still gets them through part of the motion in weight, and then we can get through the other part with a little bit more ease just from body weight. So give me a few more reps there. Notice the knees are staying behind the toes. We want to make sure we're teaching at least proper squatting technique as well. Now this is our standard plank. Notice she's going from the elbows, also from the toes. She's keeping up into a basically flat as a board. You don't want the butt to be excessively high in the air, but also don't let the lower back go into extension as well. We usually hold this for time. It's a slow twitch muscle. Next is barbell hip thrusters. I think is very good in developing the posterior chain when you can't get them actually to squat into proper positioning without pain. So a lot of times we'll have people that feel this on the front part of their thighs, but realistically we tell them to focus on using the butt cheeks and the glutes and thinking about pinching a penny between them. Posterior chain development and strength within the hamstrings, glutes, and core are very important in regards to knee conditions overall. So if you're not loading the area, even though you can't squat properly or squat without pain, I think it'll be really missing out in some of your rehab time you could be using productively while that cartilage or area of the knee heals, and you're just buying a little time. There you go. There's the 3 exercises for Chondromalacia Patella or runner's knee in the front that you can probably modify pretty safely. So I hope you enjoyed. Watch our videos, like our videos, share them. It's the way that we become popular, and hopefully this good information will become more viral so you guys can become more educated about your types of conditions and how to become empowered and work around them. Thanks. Take care.